Tuberculosis is a serious illness that mainly affects the lungs. The germ that causes tuberculosis is a bacteria. Tuberculosis can spread easily when a person with the illness coughs, sneezes, or sings. This puts tiny droplets into the air, and when another person breathes in the droplets, the germs enter the lungs. Tuberculosis spreads easily where people gather in crowds or live in crowded conditions. People with a weakened immune system are at higher risk of catching tuberculosis. Hello and welcome back to my channel. If this is your first time here, I'm Nurse Alyssa, and today we're going to be doing another 5-minute mind map. Today's 5-minute mind map is going to cover tuberculosis or TB. So as I was saying earlier, tuberculosis is a serious airborne lung infection. Okay, the infection, it can spread to other parts of the body. A negative pressure isolation precautions is needed when the patient is in hospital. Patients with latent TB, so this is an inactive form of tuberculosis, should still be treated as it can activate. So I just want to zoom in on the two different types of TB for a minute. So latent TB, TB lives inside of the body, but it doesn't grow, okay? So it's not making the person feel sick or have any symptoms. It can't spread from person to person, but it can advance into TB disease. That is why I stated earlier that when somebody has latent TB, it should still be treated. Now, active TB, so TB disease, it's active in the body and it's growing in the body. This makes the person feel sick and have symptoms. It can spread from person to person and can cause death if it isn't treated. Now, because latent TB doesn't have any signs or symptoms, we're going to be looking at the signs and symptoms of active TB. So you'll notice in the patient, they'll have a cough for 3+ weeks. They'll be coughing up blood or sputum. They'll have chest pain, weakness or fatigue, no appetite, weight loss, fever, chills, and night sweats. So how is TB diagnosed? So active TB is diagnosed through a chest x-ray, and latent or inactive TB is diagnosed through a TB skin test. So treatment of tuberculosis. So we have to use multiple medications and antibiotics over a long period of time. This is months, okay, to fully treat and get rid of the tuberculosis bacterium. So the patients need a strict adherence to the medications, possible contact tracing if they've been in crowds or tight-knit areas, and also isolation so it doesn't spread further. So the TB skin test, this is done to make sure that patients don't have latent TB. It's a way of testing them. So it is done through an intradermal injection, just directly right underneath the skin, creating a bleb. It's read in 48 to 72 hours. Now, when you're checking to see if it is a positive, you want to check the indurated area, not the reddened area, okay? So as shown here, you want to check the induration, not the reddened area. Now, it is different for different populations. So if it's greater than 15 millimeters for general population, that is a positive. Now, if it's a patient in long-term care, an IV drug user, or a healthcare worker, anything over 10 millimeters is positive. And then a patient with AIDS or a known contact, anything over 5 millimeters is a positive. All positives will be confirmed through a chest x-ray. So that is all I have for this video, guys. I hope you did enjoy this 5-minute mind map. If you are looking for more of these mind maps, you can check out my Etsy store. I do have the link down in the description. But once again, that's all I have for this video, and I hope to catch you in my next one. Bye for now.